Manager for the Waltham Pet Care Health Institute, located in the UK. And in this role, she managed a large portfolio of collaborative university-based research projects spanning multiple countries and topics, including how companion animals impact the lives of older adults, or help students learn, or reduce the impact of PTSD symptoms in military veterans. Dr. G's own publications specific to HAI and has edited and contributed to numerous books on the subject. Dr. G regularly delivers international presentations on a variety of HAI topics, serves on the editorial review boards of several peer-reviewed journals, and has actively promoted the field of HAI through participation on the boards of several HAI organizations. It is hence our pleasure to have her as a speaker at our webinar today. Before we begin, a gentle reminder to mute your microphones and post any questions that you may have to the user named Q&A, and this can be done throughout the session. Thank you. Dr. G, please.
Thank you very much for that nice, delightful introduction. I will share my screen now. Okay, Adele, I'm sorry, Audrey, can you let me know, are you seeing that okay? Excellent. Thank you very much for that wonderful introduction, and also for the opportunity to give this presentation. I'm excited to be here. The topic of the presentation is the health benefits of companion animals. I do want to give a disclaimer at the beginning. Much of this research involves dogs, so there will be a little bit more of a focus on dogs relative to other companion animal species, but that's just sort of the nature of the beast, and wanted to kind of put that out there. To start with, I just want to begin with a historical perspective on our companion animals, and in particular dogs. The process of domestication and selection of companion animals has happened over tens of thousands of years. And dogs in particular, through this process, have become adept at socializing with humans. They're sensitive to our emotional states and social gestures. They're able to communicate using complex cues, and they're able to form complex attachment relationships with humans. And if you look at these images on the screen, the one on the left is a cave painting depicting humans and dogs working together, in this case to fend off a predator. And in the Pompeii mosaic, you can see that dogs were obviously kept as pets. So their history has emerged. Dogs emerged from the gray wolf by essentially adapting to human social demands over a period of at least 35,000 years. And there's probably no other species on the planet as well matched to human social needs as dogs are. Through a lengthy selective breeding process, we now have an amazing variety of dog breeds that come in all shapes, sizes, coat colors, types. Some dogs were bred for specific behaviors and others for the way they look. Dogs as a species represent an impressive variety in which there is literally a dog for almost any occasion. When we consider the importance of pets in our lives, I think we need to reflect on the sheer number of pets kept around the world. So if you look at these numbers, in the United Kingdom, the UK, 7.5 million cats and 8.5 million dogs. In the European Union, 60 plus million cats and 66 plus million dogs. In the United States, 2/3 of all homes include a pet. That is some 63 million households in the United States. And then in Canada, 7 million cats, 6.4 million dogs. I saw an estimate for Singapore, about 824,600 registered pets in 2016. What we don't know is how many people keep pets that aren't registered. The point is that pet keeping is very prolific, and it indicates how important pets are in our lives. And a sobering reality in the United States is that children in the US are actually more likely to grow up with a pet in their home than a father. This is a pretty strong indication of this importance of companion animals to us. Dog companionship is not only widespread, but it is extremely varied. In many ways, there is no doubt that dogs are and have been helpful to humans. For example, Working dogs include assistance dogs that help individuals with vision, hearing, mobility impairments, PTSD. Alert dogs alert people to the possible oncoming seizure or a diabetic episode in which they need to take insulin. Detection dogs help to sniff out drugs, bombs, cadavers, people who are lost or buried alive, even the presence of COVID-19. And when we think about search and rescue operations involving dogs, they take place in literally every single earthly environment. When we think about dogs in terms of other issues, sled dogs, for example, helped humans to traverse cold and formidable terrain and to move longer distances than we could have done without their assistance. For example, polar exploration and vaccine delivery in Alaska was made possible through the use of sled dogs. Dogs have long helped humans to maintain our own food supplies by herding, protecting flocks of sheep, cattle, goats. Now they help protect air traffic safety by herding geese, ducks, and other birds away from airports. And they protect our leisure activities by keeping birds away from places like golf courses. In fact, apparently some golf courses can be plagued by some pretty aggressive geese. And dogs come to the rescue. So they are there to herd the geese away. And more than protecting our leisure activities, they've become a part of or a focus of our leisure activities. For example, dog sports. Dog sports are on the rise and include activities like agility, flyball, frisbee, dog diving, retrieving, obedience, scent work, high jump, and many, many, many more. So what you're seeing here are just some images of some of those dog sports and activities. But the vast majority of dog owners simply enjoy their companionship, and that can take many forms. Hiking, walking, playing fetch, training, just spending time together, cuddling on the couch. Our long history together and the continued proliferation of pets in our lives indicates that there is something unique about the human-animal bond. So let's talk for a moment about that human-animal bond. What is this thing we refer to as the human-animal bond? What you're seeing here is a definition provided by the American Veterinary Medical Association back in 2006. The idea is that the human-animal bond is a mutually beneficial and dynamic relationship between people and animals that's influenced by behaviors that are essential to the health and well-being of both. That's the definition. But what I really like about this definition are two parts of it. The first part is that it is mutually beneficial, and there is science to support that both the humans and the animals are benefiting from this relationship. The second part is that it is dynamic, in that it changes as both the humans and the animals age. So humans, for instance, when they're children, they play and interact differently than when they're adults, who interact differently from when they're older adults. And the same is true of our companion animals. Puppies and kittens, for instance, play and interact differently than adult dogs and cats. And likewise, senior dogs and cats. So the question I want to dig into in this presentation is fundamentally this: are companion animals good for us? And you can see that this little guy thinks the answer is yes. But let's find out. Let's look at the evidence. So what do we know? We know, for instance, from one study, that new pet owners report fewer minor health complaints like headaches. They report improvements in psychological well-being. And this was sustained over time for dog owners. So they continued to report improvements in psychological well-being. Dog owners also increased recreational walking. Pets are often seen as social icebreakers. So what this means is that people will risk directly engaging with people they don't even know if there is a pet present. They'll talk to people about the pet. Pets are sort of seen as the great leveler. They transcend social boundaries, race, culture, geography, politics, socioeconomic status. And one study showed that people with disabilities who are accompanied by a service dog, they experience more social greetings from other people, more approaches from other people, and they themselves report that they are more willing to go out in the evenings because they have their service animal. So what I'd like to do now is to discuss some of the scientific evidence on the topic from a real top-line perspective, but I want to separate the research into pet ownership and animal interaction. And I'll talk about animal interaction and what that is in a bit, but let's start with pet ownership because I think everybody pretty much understands what it means to own a pet. So let's talk about pet ownership with regards to children. So what do we know on the subject? Each of these bullet points represents an example result from a study. So children who grow up with a pet in their home have fewer sick days from school, less likely to have asthma or allergies. And one study on 5 and 6-year-old children reported that they were less likely to be obese. Likewise, in terms of the increases, a study showed an increase in their self-esteem. Another one showed an increase in empathy. One study showed popularity with classmates improved. And my personal favorite is that children who have pets in their home, they're more involved in hobbies, clubs, and household chores. These results are very intriguing and they're quite heartwarming and encouraging. And as a result, they do get a lot of attention in the popular press. People love to talk about how animals are good for us. But we have to be a little bit careful because this work is based on associations. What that means is that people decide for themselves whether or not they want to own a pet. So to conduct a high quality, tightly controlled experiment, scientists want to assign people to conditions. So what that would mean for pet ownership research is that we would have to assign pets to people. People don't really want that. They don't want to be assigned to have either a dog or a cat or a horse or a fish. They want to pick for themselves. So the result is that what we don't know is, do pets make us healthier or do healthier people decide they want to have a pet? So we're teasing that out, but we just have to be careful on the conclusions that we draw from this type of evidence. Take allergies and asthma as an example. It's very likely that if a child has a severe allergy to a dog, sorry, I just received a message that I somehow got muted. So I have now unmuted. So take allergies and asthma, for example. It's very likely that if a child is severely allergic to a dog, there won't be a dog in that household. What that means when we look at that correlation is that pet owners are less likely to have allergies because they sort of self-removed into the non-pet owner category. So the point is we just need to be a little bit cautious in the conclusions that we draw from this work. Now, let's move on to older adults. So similarly, we need to be cautious when interpreting these results because they're based on associations. Nevertheless, what we do see is in terms of decreases, older adults who have pets, there are studies showing that they experience less loneliness, less depression, lower blood pressure, and less stress. In terms of increases, older adults who have pets seem to have higher levels of physical activity, socialization, mental function, and quicker stroke recovery. And likewise, this work is also very interesting and it does get attention in the press. But with all that said, I would like to discuss one really nice example study that I think makes the point pretty clearly. This study was done by Karen Allen and her colleagues. She included 240 married couples, half of whom had a pet and half of whom did not. Each of these couples performed a stressful task. One of the tasks that they did was a mental arithmetic. Another one was a cold presser. So it's an uncomfortable, stressful kind of task. And they did it in one of 4 conditions. They were randomly assigned to the 4 conditions. So in one condition, people were alone. In another condition, they performed the task with a pet or a friend. So remember, the pet owners had their pet present. The non-pet owners had their friend present. The third group is they performed it with their spouse. And the fourth group is with a spouse and a friend. So let's take a look at the results. These are measures of cardiovascular reactivity. So in the upper left, you can see heart rate. Then we have systolic blood pressure in the upper right and diastolic blood pressure in the bottom. Not going to go into a ton of detail. I just want you to focus on these points. If you look in all of the conditions in which they performed the task with a pet present, their reactivity to stress was lower compared to when a pet was not present. So just to clarify, the clear bars, those are pet owners. The dark bars are non-pet owners. So what we're seeing here is that the presence of one's own pet buffers the effect of stress on your cardiovascular system. You don't react as much. Your heart rate doesn't go up as much. Your blood pressure doesn't increase as much. But what is interesting, and we should point this out, is that the presence of one's own spouse increases stress response for pet owners. So there's more that we need to understand about cardiovascular reactivity, but nevertheless, overall, the evidence on heart health for pet owners is actually quite compelling. So pet owners, compared to non-pet owners, have significantly lower blood pressure, they have reduced plasma triglycerides, and they have lower cholesterol. They're also more likely to be alive 1 year following a heart attack than non-pet owners. In fact, the American Heart Association reviewed this evidence, so the entire body of evidence on pet ownership, cardiovascular reactivity, and heart health. And after reviewing the existing literature, they issued this statement. And the statement is important. The first part is that pet ownership, particularly dog ownership, is probably associated with a decreased risk of cardiovascular disease. The second part of their statement, and this is really important, is that they are making a causal claim. So what they're saying is that it may be causally related, or in other words, having a pet may actually reduce your risk of cardiovascular disease. So this is pretty compelling evidence about pet ownership and heart health and overall health in general. As a result of this kind of evidence, some studies have argued that we are experiencing healthcare savings by owning pets. So a study reported that pet owners go to the doctor about 15% less frequently than non-pet owners. And if you use that percentage, you can estimate the reduction in overall healthcare spending. And so estimated reductions in various countries, so in Germany, for instance, 5.59 billion euro reduction for pet owners compared to non-pet owners in healthcare savings. Similarly, Australia, $3.86 billion. United Kingdom, 2.45 billion pounds. The United States, a whopping $11.8 billion reduction in healthcare savings. These are no small numbers. These are important figures. And if the evidence continues to demonstrate that animals are good for your physical and mental health, then in fact, we can begin to make claims about it from a healthcare savings perspective. I think it is important to talk about the distinction between pet ownership research and pet interaction research. So I mentioned some of the concerns with pet ownership research because fundamentally we're talking about it as associations and people self-selecting to own a pet. So animal interactions are a little bit different. Animal interactions tend to take place in a variety of locations and have a variety of purposes. And these are just some examples. So they can take place in schools or hospitals or nursing homes, and the list goes on and on. They have many purposes. In some cases, it's for companionship and just to elevate mood and make people feel better. In other cases, there's a therapeutic goal. And in other cases, there's an educational goal. So animal interactions are a bit different from pet ownership. What's nice about animal interaction research is that now we can do things that we can't do with pet ownership research. So these studies manipulate whether or not people interact with an animal. We can assign pets to people for pet ownership research, and a very few number of studies have done that. But in animal interaction research, this is easily done. You randomly assign people to conditions. You're in the condition with the dog, and you're in the condition with the cat, and you're in the condition with the stuffed animal, and so on. These studies can also manipulate the length of interaction. That's another issue with pet ownership. Pet owners have a varied amount of time that they've had their animal, and also a varied amount of time that they're able to interact with their animal. Animal-assisted interactions can manipulate the type of interaction, whether the person is walking or grooming or petting the animal, the species involved, dogs versus cats, and so on, the settings, whether they're structured or unstructured interactions. And what this means is in some cases, the animal comes in and they're just allowed to interact with the person. So there's no structure. In other cases, there is a specific structure. Okay, this is what we're going to do today. And then there are a variety of tasks that can happen with the animal. And as I mentioned before, some of these are goal-directed and some are not. Goal-directed are typically therapeutic or educational. So what I want to do now is discuss some of the top-line examples of various findings. And I want to point out that the evidence here is going to be stronger because we can use all of those things we know about the scientific method, randomly assigning people to conditions and so on. So in terms of the top line evidence for the physical health of older adults, I recently conducted a systematic review of the existing literature. Megan Mueller and I reviewed 145 studies on pets and older adults. And each bullet you see here represents one or more study showing a given result. I'd like to point out the first three bullets on the left. So for older adults, we see a reduction in cardiopulmonary, neurohormone, and anxiety measures, heart rate, muscle tension, and skin temperature, and blood pressure. If you think about it, all of those are about stress reduction. So each of those studies have demonstrated using different measures of stress that interacting with an animal reduces stress for older adults. The fourth bullet is that it's a reduced risk of falls and hospitalization rates. For older adults, that's important. In terms of the increases, we see in older adults who interact with animals that they increase their physical activity, walking distance and speed, and their walking ability and stability also improves. In terms of their mental health, so we see some studies show reductions in depression, loneliness, anxiety. In some nursing homes, there are behavior problems related to agitation, and interacting with a dog can reduce those. Reductions in fear, mental stress. On the other side, in terms of increases, we see increases in social behaviors and interactions that are very important for older adults because as they age, their social networks tend to decrease as they lose friends, and their health may suffer, and they may wind up, requiring a great deal of health care or feeling somewhat isolated because they're not able to get out and do the things they used to do. Also, interacting with animals improves their quality of life, their mood, activities of daily life. Another important thing to keep on the increase or keep going in older adults. And there are some indications of improvements in mental health. Likewise, in a recent systematic review of the literature on interactions with dogs, these were found to improve a variety of outcomes for children in school settings. So one of the, if you look at the left-hand side, what we see for children in a school setting is when they're interacting with animals in school, We see decreases in impulsivity, aggression, salivary cortisol, which is a stress hormone. The more stressed you are, the more your cortisol rises. Skin conductance, also a measure of stress. Social withdrawal. Some kids don't feel very included, but when you bring a dog in, they begin to feel included and they participate again. And risk behavior. Some kids are doing risky things. When they're interacting with a dog, they're less likely to do risky things. Also, on the right-hand side are a variety of positive outcomes in classrooms related to interacting with dogs. So we see things like reading rate, accuracy, and comprehension going up, memory, categorization, motor skills, following instructions, attention and motivation, mood, responsibility, empathy, social functioning. Wow, there's a lot of results showing that bringing dogs into classrooms can be beneficial. So what I'd like to do is talk about one specific way that dogs are involved in helping children to read. So this is a dog interaction. It's an example of an animal interaction program called Reading to Dogs. This is where children practice their reading skills by simply reading aloud to a dog. There typically are no real rules involved. A child is given an appropriate book to their reading level and an opportunity to read that to the dog. These programs tend to be wildly popular with children, with teachers, with parents, and they receive rave reviews. So together with my colleagues at the University of Lincoln, we did a systematic review of this literature. And I want to talk briefly about that review, but I really just want to talk for a moment about one example study in there that was a very good study. This was called a randomized control trial, and it's sort of the gold standard of a research study. In this study, the participants were students who were identified as poor readers. There were 102 third graders. Their average age was 7 to 13. And they were randomly assigned to one of three conditions. So each child either read to a dog with a volunteer present who was monitoring the dog, read to an adult, or read to a teddy bear, again, with an adult present to match it to the reading to dog condition. The program was a 10-week program, and the children read for 20 minutes per week to whether they read to the dog, the adult, or the teddy bear. 9 dogs were involved, and you can see a variety of different kinds of dogs. And data were collected essentially before and after the program. What's really nice about this study is it used a standardized, recognized measure of reading ability called the Neal analysis of reading ability. There were a variety of results. I want to focus in on one result that I think is quite telling. This is reading accuracy. If you look at the bar on the left, that's the children who read to the dog. The bar in the middle, children who read to the adult. And the bar on the right, children who read to the teddy bear. So reading to the dogs was beneficial for reading rate, accuracy, and comprehension in this study. And then if we step back to that systematic review, reading to dogs programs appear to improve attitude, motivation, and engagement with reading. And the program also seems to boost confidence while decreasing anxiety to go to therapy. We see increase in disclosure because, again, adolescents don't necessarily want to talk about it. We see increases in global functioning, therapeutic engagement, and retention. So animal-assisted therapy with adolescents seems to be beneficial for reducing primary symptomology and improving therapeutic engagement and retention. So it's beneficial to reducing the mental health issue while keeping them engaged in the process, which is lessons. And when we're not in a pandemic, our therapy dog teams visit throughout the health system. That means they go pretty much everywhere. So one study showed that anxiety was reduced in patients following just one visit from a Dogs on Call team. Fear was reduced by 37% and anxiety by 18% before a procedure that's considered pretty scary. So ECT stands for electroconvulsive shock therapy. So people who had a chance to visit. And then healthcare workers, we found a reduction in cortisol after just a very brief 5-minute interaction with a dog. And what's interesting about that study is that their cortisol, remember this is their stress hormone, was reduced to the same level as if they had sat alone quietly in a room for 20 minutes. And so for healthcare workers, these people are really busy. If they can interact with a dog for 5 minutes and their cortisol can go down the same amount as sitting alone in a room for 20 minutes, that's really important for our healthcare workers too. As you can imagine right now, particularly during this pandemic, they could really use some cortisol reduction. In terms of increases, dogs on call presence in group therapy increased attendance by patients. And nursing staff perceived improved mood in their patients when dogs on call visited. So that's just a top line survey of some of the research evidence out there. So let's return now to the question, do animals make us physically or psychologically healthier? The answer is probably yes. And you've seen why. Some of the evidence is stronger than some of the other evidence. But the research findings that I've summarized here, interacting with a companion animal is linked to a number of psychological and physical health benefits. So a little bit more on the yes, but. So yes, they are good for us, but we know we need more research. We need to identify what works for whom and under what circumstances so we can best deploy animals so that they are most effective. How much or how often is interaction required? That a little bit better. What populations are most likely to benefit? What is the role of pet ownership history? Some research has indicated that pet owners are likely to benefit more from interacting with pets than non-pet owners. Our stress level, blood pressure, and for older adults, it can actually increase. Think very carefully about where we can best deploy which kind of species to what effect. And then what about the animal side? I just think it's so important that we not overlook the animal side. And oftentimes in these discussions, because the human-animal bond is really about it being beneficial to both the human and the animal. So it's important to fully understand the when, where, and how animal companionship may improve human health. We also need to, so we have some very encouraging evidence. We've got a nice foundation on which to build. This is an exciting time to be involved in research on the human-animal bond. Humans have a long and varied history with dogs and with pets. At the start of this presentation, I mentioned the variety of ways working with dogs in particular, sports and other activities. There's no shortage of photos of people from historical photos. There are famous actors, singers, athletes. We certainly don't want to leave out our world leaders who pose with their pets. Posing for photos with the family pet is both fun and it's seen as a positive personality trait. In fact, there's research showing that people who are pictured with their animal, other people perceive them in a more positive light. The bond that we share with our companion animals, it transcends skin color, gender, age, politics, and many other potential sources of disagreement or controversy. Animals bring us together at a time when it seems that our world is very divided. So do I think that companion animals are good for our health? Yes, I do. And I recognize that they can't solve all of our problems. So we need to deploy them appropriately. But in the end, yes, I think they are beneficial. Thank you.
Thank you so much, Dr. G, for your sharing. It was indeed insightful, and I'm sure many of us thought so too. We'll now proceed to the Q&A session. And a big thank you to everyone who has sent in your question, but due to the shortage of time, we might not be able to get to every question, and I apologize in advance. Let's start with the first question. While there are health benefits of having companion animals, it also comes with the inevitable grief when the animal passes on. How can we help our children deal with that?
That's a great question. And there are resources that are available. There are some wonderful books that help children to deal with the loss of companion animals. I personally have been involved in helping children with this. So I've had a number of therapy dogs and I've worked with preschool children. And unfortunately, one of the therapy dogs right in the middle of the school term became very ill and passed away. And I was really worried about how to handle this. So I had the conversation with the teachers, we talked to the parents, and what we decided to do was have the conversation in the classroom with the children. And one of the things that happens is it really helps children to learn about the grieving process and to understand that it is okay to be sad and that our companion animals don't live as long as we do, and that grieving takes time and what they're feeling is okay and it's understandable. And it can actually prepare them for instances in their life later when they have people in their lives who pass away. So there are resources available online. There are books available. And perhaps I can dig up some of those and send them over to Audrey and she can share them forward.
Thank you very much. I can pass that on. The next question asks, could you kindly share more about the findings on the effect of animal-assisted intervention on elderly depression? Are there any particular drawbacks or limitations of animal-assisted therapy in the context of elderly depression?
It's a great question. So in terms of pet ownership and depression, the results are a little bit mixed in the literature. What we find is that some studies report that owning a pet, those individuals have less depression, and other studies report that people who own a pet have more depression. So what we don't fully understand is it possible that people who acquire a pet do so because they're depressed? Maybe they're self-medicating. And so when, oftentimes when you're feeling down, somebody might say, hey, you need to get a dog. And people may do that. And so that may explain those mixed findings for pet ownership. In terms of interaction, this is typically done in a nursing home setting, and the existing studies have demonstrated that when we are measuring depression and animals are brought in to interact with older adults in that setting, we do see fairly consistently reductions in depression. And those interactions can vary. For instance, there was a study done by Erica Friedman called the Pet Assisted Living Study. And in that study, she brought in dogs, and the older adults could do things like brush the dog, change the dog's collar, do a variety of things with the dog. That was one condition. Another condition was called a reminiscing condition, because you have to balance the fact that when the dog comes, so does a human. Their handler comes with them. And the participant usually talks to the handler. So in the reminiscing condition, that included that communication with the handler. So the older adult was allowed to reminisce about things in their life, tell stories, and just chat. What we find is in these interactions with the dog, we see a greater reduction in depression than the other conditions. And that's fairly consistent. Are there risks associated with it? The reality is that anytime you're bringing animals around older adults, there is the potential for risk. We need to face into that. We need to be prepared for what those are. The risk can happen from bringing the dog in from the parking lot into the building, and we just need to make sure that that is handled in a safe way. For instance, one of the studies that I was working on, there was a door that would swing really fast, and they were concerned that the door would hit the dog's tail. So what we did, we recognized that the door was there, and we had the handlers always come and go through a different door. So in terms of the older adults, we really want to make sure that we have people there monitoring the interaction to make sure that the older adult doesn't attempt to do something outside their ability level. So for instance, if an individual is no longer walking, we don't want them to suddenly try to walk just because there's a dog there. We'd want there to be people there to support them if that's an appropriate activity.
Yep, thank you very much. For the next question, are there studies on which breed of dog are better suitable for a certain role for AAI? For example, is there one breed that's better at detecting seizures or reducing levels of depression in the patient?
This is a really great question. So there are a couple of parts of this question. So first of all, are there studies about different breeds' efficacy in animal-assisted interventions? Those so far have not really been conducted. There's very little evidence about which breed is most effective. And part of that is because therapy animals are selected purely on the basis of their behavior and suitability. And so, for instance, in our Dogs on Call program, we accept all breeds of dogs, even some dogs that some people classify as scary dogs, like Doberman Pinschers, for instance, or German Shepherds. If these dogs, and many of them have amazing behaviors and willingness to participate with individuals, if these dogs behaviorally can do the work, they do the work. So we don't really look at these differences in dog breeds. Audrey, can you remind me?
Seizures or depression.
Yes, thank you.
Yep.
Thank you. So that second part of the question is really about assistance dogs. That's a different animal, if you will. So assistance dogs are trained specifically to work with golden, sometimes poodles. So they mix in breeds because they often breed their own dogs for that purpose. But the reality is that service dogs come in all shapes and sizes. For instance, I need to be trained to detect the seizure coming on.
Yep, thank you very much. For the next question, what type of individuals or who, with what kind of conditions may not be suitable to undergo animal-assisted therapy? Are there any specific conditions? Yep.
Absolutely, there are. Some populations are violent or act out against others. And we would never want to bring an animal into it. So be careful in situations where people may be unintentionally violent. So for instance, some individuals suffer from movement disorders that mean that they can't really control their movements. So we have to be very careful about how we might bring an animal into that situation. Because again, we wouldn't want the animal to be harmed. Because if the animal is harmed, that raises the potential for the animal to protect itself. And that's natural. An animal should be allowed to protect itself. And so by protecting themselves, usually they want to run away. They want to escape. That can create problems. They can get tangled up in IV lines and a variety of other things. So we have to really try to reduce the potential for that to happen. And so part of what we need to do is really look at the population that we're going to bring the animal into. Do they have the potential for violence or harm to the animal or the human handler? Are they allergic to the animal? Because if they're allergic, we really want to be careful about that. Perhaps they're allergic to dogs, so maybe they could be involved in viewing fish. You know, there are other ways that we could go with that. But we do have to be very sensitive to what the population is like and whether or not they themselves are prepared and want to participate in animal-assisted interactions. The reality is that there are people out there who don't like animals. And people who don't like animals should not be involved in animal-assisted interactions. They're very unlikely to benefit.
Moving on to the next question. What are your thoughts on employing assistance dogs to help diabetic and seizure patients?
My thoughts in terms of helping patients, so if we were to bring dogs in to help those patients, it's a little bit different from an individual having a service dog for that purpose. So service dogs who are trained to identify low or high blood sugar levels or the onset of a seizure, those individuals, once they're paired with their human, that can be amazing. That can really open that person's life up to so many possibilities. Being able to do that with a wider variety of people, having a single dog that goes in to detect that in various populations, that may be a little bit harder because the dog may be reacting to one individual person's signs. And so that part may be a little bit more challenging to accomplish. But in general, how I feel about it is I think it's amazing. And we're seeing people suddenly able to do things they weren't able to do before and have confidence to go out in public because they know they've got their dog there and their dog will let them know if something's about to go wrong. And they can get to a safe space. They can take their medicine. They can do what they need to do and then go on about their day.
Okay, thank you. The next question is from someone who's been very inspired and asked, how can I become an animal-assisted therapist?
Ooh, animal-assisted therapist. Okay, so a therapist is usually a professional. So this may be a mental health professional, occupational therapy, and you want to get training in animal-assisted part of that. So you could go to a place like Oakland University, for instance. They have an entire certification program, and there are other places that have certification programs that help professionals learn how to incorporate animals into their therapeutic sessions in a way that is effective to the patients and safe for the animals and fun for the animals as well.
Thank you very much. Next question. Is there a thing as too much animal interaction, and how do we get the balance right?
Oh, it's a good question. It's a good question. I have not yet encountered a case where there is too much animal interaction. There are people who have their animals with them 24 hours a day, 7 days a week, and they can handle that quite successfully. It is so individual specific. So if you have your animal with you, for instance, while you're working at home during a pandemic and you're trying to get stuff done and your animal is jumping up on you, that can become a source of frustration. So you'd want to handle that. So that for you might be a little too much animal interaction. So you just want to think about ways of dealing with that. And by the way, I have worked at home quite a bit during the pandemic. One of the things I would do is I would get a toy for my dog that you can fill with like peanut butter or something. And I could put my dog in their crate or on a pad with a Kong or some toy that could entertain them so that I could then go about my Zoom calls without interruption, because they want to interrupt us. And, you know, one of the things we're seeing during the pandemic is some of these most delightful videos of people who are being interrupted by their pets. And it helps us just take a moment to breathe and to realize that, wow, there's this cute little creature, and kind of have this moment of brevity during an otherwise, you know, intense Zoom meeting.
This leads quite nicely to the next question. Have you seen a change or an increase or decrease in the use of pets for therapy during this?
Pets here in the United States during COVID, and probably worldwide. I'm most familiar with it here in the US. Basically, the shelters were running out of animals because people wanted to have a pet. They're at home. This is the time when they can have an animal in their life. And people are recognizing how much they enjoy having a pet, and they're spending time with their pets. And I think from the pet side, some pets love it. Anxiety when their humans aren't around anymore. There are ways to deal with that. So as I mentioned,
animal-assisted interactions versus owning a pet.
And dogs are benefiting from the interaction. We need more science on it, but early indications are that these therapy dogs don't see it as work. They're excited to put their vest on. They actually pull to come into the hospital. Their tails are wagging. They can't wait to do what they're doing. So all indications are that they're enjoying it. But I also want to say one thing, and that is that we cannot assume that every dog will enjoy it, because some dogs just don't. It isn't what they want to do. And so we have to respect that. And if the dog indicates that they want to leave, we always let them leave.
Yep, I think that's all the questions that we have. Thank you very much, Dr. G, and everyone who submitted a question. We've come to the end of the first of the webinar on the science of animal-assisted interventions, and we hope that you managed to gain some insights into this field and a greater appreciation for the pets around us. Head over to our Facebook page, Animal Buzz SG, for more educational information on animal ethology, and like the page for regular content. If you did not manage to catch this afternoon and this session now, you may also view it live by visiting